Hi, I'm Dr. Jamison Spencer with Cadwell Therapeutics. Today I'm going to fit the silent sleep from beginning to end, just showing exactly the steps and processes and exactly how long it takes to fit the appliance. First thing we would do is check in the patient's mouth to make sure that there are no problems. We're looking for mandibular tori. I'll show on another video how to prepare the silent sleep tray if there are tori so that you don't hurt the patient at all. Also looking for long span bridges or other things that the material may lock under. Open. Okay, and all looks good here. Jenny has a permanent retainer, which is no problem at all, so everything looks good. I typically won't necessarily try in the silent sleep tray. If there are tori, again, I'll prepare the tray with some wax, but otherwise there's usually no reason to try in the tray itself. So the next step is we are going to determine the mandibular position using the silent sleep bite gauges. The gauges go from end to end, so the teeth end to end, or 0 is indicated on the gauge, +2, +4, and +6. So we have the different jaw positions. Typically the easiest way to do this is to have the patient make a snoring noise in the back of their throat, just a type of noise, and then try this different jaw position to see which one most effectively reduces that noise, which one makes it harder for them to make that snoring noise in the back of their throat. With the 4 different bite gauges here, we actually have 7 different positions. So 0 being end to end, but let's say that the patient is unable to go that far forward. They have a major or a significant overjet, and coming end to end is not possible for them. They can't protrude their jaw that far. Then we may take the typically +2 gauge, flip it over, and now that is going to be -2. The +4 becomes -4, the +6 becomes -6. So let's start off here with the 0. So go ahead, Jenny, and make a snoring noise in the back of your throat. Okay, good. And open, close down. Good, make that same noise. Okay, more difficult for her to make it there. And we'll go to the +2. Open just a little bit. There you go, close. Oh, and make that noise. Okay, a little harder. We'll go to the +4. A little bit farther forward there. There you go. And noise again. Okay, and if she really can't make the noise at all in that position, now that's fairly far protruded, so I don't think that we would go in that position initially. The +2 is where I would start in this case. You might even start with the end to end because that did make a difference. It kind of depends on what your immediate goals are. In a patient where you know that they're going to be able to come back pretty quickly in a week or two and give you some feedback on if the snoring is better, then you may start them a little bit farther back. Ideally, we want the patient to have a good experience with wearing the appliance through the night, not having any jaw discomfort. So starting in a little bit less protruded position, more in that end-to-end range, and then going from there if needed. You may find that end-to-end is all that patient needs. Again, in my experience, it's more a key of keeping the jaw from falling backwards rather than bringing the jaw significant amount forward. So you might start in that end-to-end position. Again, in this case, I think we're going to start in the +2. That seems to be a good position for her, and we can always go backwards too. If the patient does say, well, I'm not snoring anymore in that position, but it is uncomfortable to my jaw, then we may decide to go back a little bit. So we're going to go to the +2. So I'm going to take that gauge and put it to the side here so I know I can grab that. And then we have the silent sleep tray, of course. Now, originally we would just hold the tray, and you may still do this with your fingers. You can hold the tray like this and flip it over as you fill it up. But we also now have the silent sleep fitting fork that we've developed, which will hold the silent sleep like so. And then we can fill this in the normal manner, just without getting our fingers as dirty. Go ahead and put it in the patient's mouth when it is full, close, biting onto the bite stick, and then pull that out once the bite stick is in place, and then the tray will go in very nicely. So this makes it a little bit more convenient, a little easier to learn how to fit the appliance with the fork. So it just simply goes on, very easily. This is made out of metal or wire so that you can bend it to however wide or narrow as you need to. It will grab the tray really well. And again, pretty straightforward, pretty simple. So I'm going to use that, and I've got everything set up here. I have our GC reline, And I'll use the gauge to show how this is done. So when I am filling the tray, I just make sure that I'm not incorporating any air bubbles there. Focus it around just all areas of the tray, up on the sides. And make sure I'm hitting the holes. Flip that over. We can go back to connect it in the posterior too. And then an important point here is we're going to add some on the holes. And you can kind of do this on the top and the bottom of the fitting fork. You don't necessarily need to do it right over the fork. And those will coalesce onto each other after we remove the fork. So just on the holes. And by doing that, we are going to connect the material 360 degrees. So it is through the silent sleep tray everywhere, which means it will not be able to easily come out. And patient open. And then this is basically just like putting a impression tray in the mouth. I'm going to push down a little bit to get on the back teeth. Close slowly. Good. Bring your tongue forward. Good. Going to slide that gauge out. Make your tongue nice and fat. And just kind of push in here with your cheeks. You can close your lips around it. Very good. So tongue forward and fat. By bringing the tongue forward and making it nice and wide, we're going to make the appliance as small as possible in the tongue space. So it's going to literally spread out the appliance on the tongue space and make the tongue space as great as possible. That's important with any of these appliances. We'd like to have a maximum tongue space, and we want to have room for the tongue to come forward. By putting the material on the buccal and the lingual, we're making impressions also of the tongue in that forward position. We're making an impression of the cheek out on the side, so it's going to be very comfortable for the patient, very smooth. It fits the teeth perfectly, obviously, because we're taking an impression of the teeth. So the retention tends to be very good, and the fit tends to be very good. On the gauge, I'm either going to hold it myself or keep a close eye on it. We don't want the bite gauge to go down, or that would bring the jaw backwards. If we push it up, it would bring the jaw farther forward. So we want to keep that basically flat here. Let me take a look there. Good. And you can see it's still a little tacky there. Okay, and close your lips again. The patient needs to keep their teeth into the grooves, but they don't need to really bite down very hard. As a matter of fact, if they do bite down significantly hard, it may cause a little tension in their muscles or in their jaw. So I tend to tell them to keep their teeth there, but you don't have to bite really hard. If you have the patient, you fit the appliance, and as you see, this takes a few minutes. So typically, we're going to let that set in the mouth 3 or 4 minutes. And if they feel a little fatigue, assure them that that's not going to be the case when they're wearing it, because they don't need to sit there and bite on it all night long. All right, let's check again. All right, maybe just one more minute. Let's see. Okay, and open. So pulling that off the teeth, we have really good adaptation along the teeth on both the top, bottom and the top there. Now, a lot of this material is not needed. So obviously I can take this off here, take this off down here on the lingual side. We may leave that. That's a little long, so I can cut some of that off. I'll cut all of this off in the front. But that's a very nicely adapted tray there. So we will just simply want to trim some of the excess up so it's not as bulky, and we'll do that in the lab in another take here. Okay, now we're going to trim the appliance that we just fit in the other room. So I'm just going to take scissors and cut off the excess material. I will trim off right up to the premolars. Anything that is on the palatal side, I will cut off. And I'll also trim off in the retromolar pad area. We don't need the material back there. If I see any material that is completely in between the teeth, then I will cut that out. So it's okay to have it in the embrasures, but I don't want it going all the way through to the other side, because that could contribute to opening up spaces that are probably already there. Now on the lingual, this is down quite a ways, so I don't think that we would leave that, but typically I will leave most of the material that is on the tongue side and down by the tongue. But in this case, it's a little bit excessive, so I'm going to go ahead and trim that up. I don't need to trim it all the way up to the tray, though. It's kind of nice to have a little material go down to encourage the tongue to come up. Okay, so that's pretty good overall. Now, in some cases, that may be it, and you may be done just by trimming it with the scissors a little bit, and that would be it. If we were to take this back to the patient now and have her feel around with her lips and tongue and cheeks, I'm sure that she would say that it's quite comfortable. But if we want it to be even smoother, even better, then we can use a burr to smooth that out. The burrs that I like to use, and we'll get a close-up of these, are cross-cut burrs, and they are really aggressive burrs, and this type of aggressive burr is nice for trimming softer materials. So I prefer this one here. So I'll put that in our high-speed hand, or our low-speed handpiece here, and I run that at the highest RPMs on my lab handpiece there, and just smooth that out. And you should be able to see there that it results in a very nice smooth finish. Now, any place that's really thin, we can cut that off. So I'll just tend to go along the edges where I trimmed with the scissors, go back in the retromolar area. So any place that I cut with a scissor, I'm just going to smooth that out just a little bit. Again, in the retromolar pad area, I'll take out a little material, just like I was doing a partial denture or a denture, so that we're not putting excessive forces in that area. On the tongue area, we're going to want to make sure that that is nice and smooth. So again, most of the time I wouldn't even trim that with scissors, but this time, because it was a little bit too much material there, I trimmed it, so I want to smooth that out. Here again on this side, same thing. Once we take this to the patient's mouth too, and we'll ask her to feel around to see if there's any place rough or pokey. If there's anything that she comes up with, then obviously we can just come back and trim that up very easily. So with this step included, the average fitting time for the silent sleep, even with smoothing out like this with the handpiece, should be less than 10 minutes. Okay, that looks good. So now I'm going to just rinse this off and take it in and see how it feels. Okay, we've come back in from the other room from trimming and smoothing this out. Just going to try it in the mouth. And you might put this in the first time for the patient, but of course we want them to get good at that too. Go ahead and close. And very easy to find the position. When patients do it themselves, go ahead and open And Jenny's done this before, so she'll probably do it pretty easily, but go ahead and pop that in. What most patients will do is they won't put it in far enough back, and so it'll be forward, and so they have to feel what that feels like to be in the right spot. So go ahead and feel around with your lips, your tongue, your cheek, and see if there's any place rough or pokey.
No.
Feels okay? Okay, let's go ahead and pop that out. Now, of course, if she had found a spot with her tongue, we could go back in there and smooth that out with a burr like I just showed. One thing I also wanted to show is with pushing the tongue out to the side like I had Jenny do, it is thin on this side, on the lingual side, and thick on the buccal side, and that's what we were going for. So you can tell if the patient did that correctly by looking at the appliance after it's fit. It should be thinner on the lingual side and thicker on the buccal side, meaning that the lingual is as spacious as possible. So that's fitting the silent sleep from beginning to end. Again, after you've done this a few times, should be able to do this procedure in about 10 minutes.